First day clinical placement. How do I feel at the student? Good afternoon, everybody. Jong in Australia again. It's gonna be for a while. I only do one video per week now. But I was busy with work and moving the house to somewhere else. Hope this video will gonna be the benefit for everyone who listening. I try to get some video content that might help a lot of people in some good information and content. Today I want to share about my experience on the first day in the clinical placement. I was sharing about clinical placement for nursing in hospital or in nursing home in the previous video. Today I want to share about my own experience. What do I feel? How do I feel in the first day, first year in the clinical placement? Where I am, I was placed in the hospital a bit further from my house for 2 weeks in first time. I was so exciting, not always exciting. I'm nervous because I don't know what I gonna expect to do and how they gonna treat me and what can I do and cannot do. So I have to prepare myself, but I can't deny, oh my God, I will pass a clinical placement or not. I have to prepare myself very well. Before the clinical placement come up, I have to go through all the paperwork. They have to check up all the vaccination record. It's important. Everybody need to comply with the vaccination record, which you have to show them. If not, they not allow you to do it. You have to sign some paperwork. The university will organize and arrange it. You have to make sure all the paperwork will be handed to them. And in the first day, you need to have an orientation. So in my first rotation in my uni, we place in 3 different wards. So will be 6 students in 3 different wards. So 2 students in 1 ward in different medical ward. I'm happy that I placed with my friend. We can't deny. We don't know anything first year. What they want us to do, what they expect me to do. Oh no. But one thing, they have some course regarding at what the expectation from the placement from the hospital that they place at to learn and achieve more skill and experience about nursing. So first placement, I only observe the observation. So whatever RN do, we need to follow them and observation, like observing what they've been doing, why they've been like that. And other thing, when I saw they do medication, how do I know that all kind of this medication, what do they treating? I'm not a pharmacy. So what I do, I just start to panic. I'm gonna do a wrong medication. I become an RN. That's what I thought. And I remember one of the registered nurse which they pair me up. They say, you don't need to worry. When you start to know, and then you start to learn, and then you start to work, it will be nearly the same medication, treating nearly the same thing most of the time of the patient who admit in the ward, all right? So it's like hypertensive medication, antidepressive medication, high cholesterol medication, or the sleepy tablet. You will know and you will familiar with that. Don't worry. What about the pain relief? Oh, too many. How do I know? How do I calculate it? It's about worry word because of we first year and we pair up in the medical ward. And then they do a lot of things busy there. And I say, how do I know that? How do I palm the line for the IV? Oh, how do I set it up? Oh, so many questions that I start to panic. And I say, Oh, I have to go there early. I have to prepare myself. Where do I park? Oh boy. So this is my experience of first day placement in the hospital. But before my placement come, what I done, I know which hospital I'm going to, right? So I'm very bad at driving the direction on those days long time ago. So what I done, I look at the address and then I go and look at the hospital first so I won't be missed in the morning because I'm in the morning shift. So I want to know how long from my place to get there because it's traffic and past the airport. So what happened? I just go there and observe the direction and try to get where do I park and how far do I have to walk and how many minutes. So I don't want to late. I'm just worried about the time. We cannot be late and things like that. And then I prepare myself very well. Other thing on top of that, when I go there, they place us in the medical ward. And then what happened if the RN asks me some question about things and I can't answer? Are they gonna fail me on the clinical placement? I'm telling you, just be yourself. And if you're not sure, you just ask in the scope of the placement in your first time. They're not gonna be upset with you. You're a student. You come to learn. You come to observe how the skill of RN in the hospital, and they're willing to help you. Why can't I say that? Because right now I'm a RN. I'm not upset with the student. I ask the student, are you confident to do this? What your scope can you do? What is your perspective and expectation for this placement? So when I think back and am a RN and perceive or the nursing student, how do I feel? I understand them. They nervous, they panic, they worry. They just don't know how to observe because it's their first time. You can see a lot of nursing students, they're walking around because they don't know how to do that. Believe me, you will pass through it and you will be okay. So my first day in placement, nervous, exciting, worry, and how I gonna perform? Are they gonna pass me? This feeling is just quite common. So if you are a nursing student and have to place in the hospital or nursing home first time, prepare yourself well and then you will be okay. Believe me, they're not gonna be harsh or tough with you. Just comply with the placement and you will pass. Good luck for everyone. First placement might be exciting challenge, but you will learn a lot. Don't forget, prepare yourself. And if this video is useful for you, don't forget, subscribe. Jong in Australia. I'll see you in the next video. Thank you for listening. สวัสดีค่ะ I say in Thai. And don't forget, follow Jong in Australia. A lot of things that you're gonna have the useful information. Nursing in Australia. Jong. Bye bye. See you.